In this video, we'll look at some resources for finding information about specific communities for healthcare needs. The page we're looking at right now is the Community Health page on the LibGuide for Occupational Therapy at Brenau. However, if you're in another graduate healthcare program at Brenau, your LibGuide should have something very similar. So you'll see that the information on this page is broken down by state and local data, health status reports, national data, international data, and citing sources in APA style. We'll look briefly at each one of those, but before we dive in, I want to make sure that you can see the contact information for the librarian over here on the right side of the screen. We're going to look at a lot of resources today, but these are really just the tip of the iceberg in terms of the amount of health statistics data that are available. So if you get stuck or you're not finding what you need for your community, don't hesitate to contact the librarian. I would be happy to help you with anything that you need. So let's look first at the state and local data. This drills down to specific communities, whether that's a town, city, county, or potentially state. There are 3 examples that we'll look at here. There are many other options available if you're not finding what you need. Let's look first at the US Census data. There is a lot of information that you can gather from the US Census. The way I'll use it for this example is just to search for the name of a city that I'm interested in. So for example, let's search for Norcross, Georgia. And we have the big font here that indicates this is probably a major entry. So we'll look at the city of Norcross. We have a bunch of demographic information here. You see that there's a health tab to the side. So you can click the health tab and get information about health and disability issues that have been reported by the US Census in the city of Norcross. So this is all great. And another great thing about it is it points out where this came from. So you can figure out, well, which survey did this come from? How old is this information? And you can click on the link survey and dig down to more if you'd like. That was the health tab, but also don't neglect these other tabs over here that talk about the population information, income, education, employment. These are all things that can have an impact on your community's health needs. So these might be useful for your project, even beyond just the health area. I'll close out of this and go to the Georgia Division of Public Health. Their system is called Oecd. So before we were in the entire United States Census, this is specific to the state of Georgia. Clicking on the Oecd link, you can see that there's information about a lot of different health topics. There's a bunch of dashboards for various community needs assessments. You can look at morbidity and mortality across a variety of causes, across a variety of population like maternal, child, infant. You can look at population characteristics for the state of Georgia or behavioral surveys. So I will look, for example, at the Behavioral Risk Factor Survey. And you can see that this is not quite as clean and browsable as the US Census data that we saw earlier, but there's still a lot of great information in here. So I would select a behavior category. For example, I'll look at chronic conditions that people might have, and that gives me some options for which behaviors. Let's look at what's going on with diabetes in the state of Georgia. So I select those and I click the red Get Data here, and I get information about the percentage of adults with diabetes. This is from the year 2017. And we have a breakdown for the entire state of Georgia by totals, by male versus female, by race, or by age category. And then they also break it down further by which region of Georgia we might be looking at. So even if it doesn't specifically say the city that we're interested in, we could figure out, well, my city is in Northwest Georgia near Rome, maybe it's in North Georgia near the Gainesville area, and we can gather the data from there. Closing out of that, I'll come back to the City Health Dashboard. This is city level data, and it's nice and comprehensive about each city, but it doesn't necessarily have every single city you might be interested in. So for example, I'll enter Gainesville here in the city search, and the only thing that pops up is Gainesville, Florida. So when you're doing a city search, be very sure that you are looking at the correct city in the correct state. So Gainesville is not something that's available to us. Let's search for Georgia and see which cities in Georgia they have information for. There are a bunch here. I'll look, for example, at Johns Creek, Georgia. And we could look at just an overview of everything about Johns Creek, Georgia, or we could select one of these metrics. Am I interested in a particular health outcome, social and economic factors, behaviors, physical environment, or what kind of clinical care they have? I will look again at diabetes for Johns Creek, Georgia. So I'll click the diabetes link. And it gives information about how many adults in Johns Creek reported having diabetes, and also it compares it to how many people in other cities have reported diabetes. So this tells us how we compare against other cities, and it lets us know, well, is diabetes a real problem for the people in this city, or is it relatively okay and we could maybe focus our needs assessment somewhere else? Those are just 3 of the ways that you can get statistics about a particular community in the United States. If you don't find what you need here, again, make sure that you contact the librarian and try to get some help. Another place to check are for health status reports and needs assessments that have already been written. So if you go down to the next box here, you'll see that state and county governments very often will write community health need reports or health assessments. Also, hospital systems often write these health needs assessments and community reports. So they may have done some of the statistic gathering for you. I have examples here of health assessments for the whole state of Georgia, for the general metro area, and links to some hospital systems reports in the metro area. If you're not working in the community in the metro area, so this isn't useful to you, you can still get this kind of information. So think about where your city or town is located and check the website of their local Board of Health or Department of Public Health. Check if there's a major hospital in the area. Google, the name of the hospital plus community needs assessment. So all of these resources have been pretty focused at the community level. You may find some helpful information at the national level. So these 3 links for national data are really useful for seeing big picture, broad societal trends. You may not be able to pull the information that you need specifically for this community out of these sources, but they can give you a big picture of, in the entire United States, how much of a problem is one particular element. The first link here is health data from the United States Census. So this is a list of reports that have been prepared on health-related topics from the US Census. You can look at how many people report having health insurance, disability employment data. I'm going to look here at the disability data link. And this will give information about various aspects of people with disabilities. For example, in 2017, they wrote a report about workers with a disability by detailed occupation, really broken down. How many people in this line of work had a disability and what kind of disability was it? So you click on that link and then you choose which one of these tables you're interested in seeing. I'll click on Table 2, Workers with a Disability by Detailed Occupation and Type of Disability. So you can see how many people who are listed as working in management, business, and financial occupations reported having a disability and what kind of disability it was. You can keep scrolling across to see more. And of course, you can scroll for ages looking at all of the different kinds of occupations that they had kept track of. I'll close out of that and close out of this tab, going back to the community health page. The CDC National Center for Health Statistics is another place where you can get big picture information. They have population surveys, vital records, provider surveys, all kinds of health-related data. The front page changes quite a bit because they can try to keep it updated with what's going on in the world. I'll scroll past the first few rows and I look at 2 places here. The first is the Data Collection Systems tab. So you see that there are all kinds of different surveys and report collections listed here. So you might skim over these and see if any of these kinds of surveys look useful to the information you need. You can also check out the Topics tab over here. And again, skim what's listed here, see if any of these are going to be useful to your project. I also like to click on Fast Stats. And that lets me get kind of big picture snapshots of what's going on with really common diseases, conditions, health situations. So I'll click on diseases and conditions over here on the left side and look at diabetes. So I get a little snapshot of how many people report having diabetes, how many were diagnosed by a physician and so on, how many doctor's visits were based on diabetes. So we have little snapshots of the numbers. And then another nice thing is that it links to which survey this came from. So if you want to drill down to more specific information or see the raw numbers on this, you can just click on what they've listed as the source. Close out of that. The last thing listed here is Cdc Wonder. And Cdc Wonder is a really powerful tool. It lets you build your own customized queries and make tables that are exactly targeted at what you want to know. But it is not really browsable at all. You need to know going into Cdc Wonder exactly what you need to know, what your question is, and how you're going to set up your query. So it's a fantastic tool, but it's not especially user-friendly. It's a little labor-intensive. So if you want to use this, feel free to try it out yourself or contact the librarian for help. All of these sources that I've just talked about have been focused on communities in the United States. Sometimes, though, you might be working on projects about a community outside of the United States, whether you're looking at an entire non-U.S. country or if you're looking at a specific state or town in another country. So we have two approaches to this. This first set of links are for health statistics at a country level. It might include the United States, it may not. The first link here is OECD Health Statistics. And OECD has a real economics focus, so you're going to find a lot of information about health situations that impact or are impacted by global economics. So this OECD Health Statistics, you can scroll down and you can choose one of these topics that you want to explore, or you can scroll up and browse by country and find the country that you're interested in and get an overview of the health situation and economic situation of that country. The next link is the WHO World Health Organization data collection page. And there are three ways you might search this. You can use their search box right here. You can browse their health topics. So they give overviews of health situations that have a global impact, and they may break it down by country, or they may just talk generally about, here are the global impacts of things like air pollution. Or you can search by country and you can get a report of the health situation of a particular country that you're interested in. And the last link, Stat Compiler, is sort of similar to Cdc Wonder in that you can build your own custom queries and tables and get a lot of really powerful information, but it's a little less browsable than the other ones had been. So these three links give you information about countrywide health situations. If you are trying to find community-level data about a community outside of the United States, you're going to need to think a little bit creatively. So remember how early in the video, we looked at state and local sources for information, and a lot of those came from the federal government or the state government. Other countries will have very similar setups. For example, let's pretend that we're interested in the state of Yucatan in Mexico. There are a couple of links here to statistic websites from the Mexican federal government where you can drill down to information about the state of Yucatan. So there are two links here. They both have a ton of not only health information, but also demographic and social and economic situations that can really help illustrate a larger picture of your community's health needs. Then other options, here is a link to that OECD Health at a Glance page that we looked at earlier. This is a link straight to the overview for Mexico. And then you could also look in a medical research database for medical research or healthcare research that has been done in your community. After you find all of these sources, you're probably going to need to cite them in APA style. We have a whole APA 7 guide that is linked right here. Inside of that APA 7 guide, we have a statistics page and a government documents page that will be really helpful for citing a lot of these statistics, because many of them are going to be coming from government documents or from statistical data sets. We've also put some really health stat targeted tips and examples here in this box. These health statistics could be a little quirky. Sometimes it's not entirely clear who the author is or how to cite it if the author is actually a huge organization, like the Centers for Disease Control. There are also some examples of titles. There can be quirky titles like, oh, the word salmonella is already italicized in this title. What am I supposed to do with it? So there are some examples there. I hope this has been a helpful, quick introduction. If you are stuck, Here's the librarian's contact information. Please contact me if you need anything. Thank you.